Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com, Top 20 Vaccines You Should Know About. Vaccines are among the best ways a parent can protect their children from certain infectious diseases. Vaccines can also prevent diseases in adults and limit the spread of infection through communities. In some cases, vaccines have completely eliminated once dreaded diseases. /r/n/r/n It is important that everyone gets vaccinated per the immunization schedule recommended by the Centers for Disease Control and Prevention, CDC, not only for their own health but for the health of others. /r/n/r/n Hepatitis B is a viral disease that causes liver inflammation and damage. Over time, chronic hepatitis B infection can cause cirrhosis, liver failure, and liver cancer. /r/n/r/n In the United States, an estimated 580,000 to 2.4 million people are chronically infected with HBV. Up to 25% of those infected as infants will die as a result of liver disease in later years, which is why it is important to prevent infection by vaccinating at birth. /r/n/r/n There are 3 HBV vaccines licensed for use in the United States, each of which is delivered by intramuscular injection, IM. /r/n/r/n Tdap vaccine is a combination vaccine that protects against 3 different bacterial diseases. /r/n/r/n There are 2 DTaP vaccines approved for use in the United States. /r/n/r/n The Tdap vaccine is a combination vaccine used to boost immunity against tetanus, diphtheria, and pertussis. There is also the TD vaccine that protects against tetanus and diphtheria. /r/n/r/n Tdap vaccination is currently recommended for /r/n/r/n There are 2 Tdap vaccines approved for use in the United States. /r/n/r/n The Haemophilus influenza type B, HIB, vaccine protects against Haemophilus influenza type B, a bacteria that can cause pneumonia, meningitis, inflammation of the protective membrane surrounding the brain and spinal cord, and epiglottitis, inflammation of the cartilage flap covering the windpipe. /r/n/r/n There are 3 HIB vaccines approved for use in the United States. /r/n/r/n Pneumococcal vaccines protect against Streptococcus pneumoniae, a bacteria that can cause pneumonia, meningitis, and bacteremia, bacterial infection of the bloodstream. The 2 types of pneumococcal vaccines are pneumococcal conjugate vaccines, PCV15, PCV20, and PCV21, and the pneumococcal polysaccharide vaccine, PPSV23. /r/n/r/n There are 4 pneumococcal vaccines approved for use in the United States. /r/n/r/n PCV21, also known as Capvaxive, was approved by the FDA in 2024. It protects against 21 serotypes of pneumococcal bacteria. The CDC recommends Capvaxive for adults 19 to 49 years of age with certain chronic medical conditions or other risk factors who have not been vaccinated or whose vaccination history is unknown. Additionally, Capvaxive is recommended for adults aged 50 and older who have previously been vaccinated with PCV13 or PPSV23 or whose vaccination history is unknown. /r/n/r/n Polio is a rare viral infection transmitted through contaminated water or food or direct contact with an infected person. The vast majority of infections occur with no symptoms. Less than 1% of those infected will develop paralytic poliomyelitis, while between 1% and 5% will experience non-paralytic meningitis. /r/n/r/n There is 1 polio vaccine approved for use in the United States, called IPOL, that is made with an inactivated, dead, virus. /r/n/r/n. The live oral polio vaccine, used in the United States for almost 40 years, was discontinued in 2000 due to the potential risk of vaccine-induced poliomyelitis. /r/n/r/n. Rotavirus is a viral infection that can cause severe gastroenteritis, stomach flu, in infants and children, leading to dehydration and, in some cases, death. Rotavirus is the most common cause of childhood diarrhea worldwide. Roughly 80% of rotavirus deaths occur in the developing world. /r/n/r/n. Prior to the development of a rotavirus vaccine, an estimated 3 million cases occurred in the United States every year. /r/n/r/n. There are 2 rotavirus vaccines licensed for use, each of which are delivered orally, by mouth. /r/n/r/n. The MMR vaccine is a combination vaccine that protects against 3 different diseases. /r/n/r/n. There are 2 MMR vaccines approved for use in the United States. /r/n/r/n. Varicella zoster virus, VZV, causes chickenpox. The disease is highly contagious, causing itchy, fluid-filled blisters on the skin. Young children are at the greatest risk of hospitalization from chickenpox. /r/n/r/n. There is one varicella vaccine, called Verivax, approved for use in the United States. /r/n/r/n. Hepatitis A is a viral disease that causes liver inflammation. It is typically transmitted by the oral fecal route. Though rarely fatal, hepatitis A can cause epidemics, which are a major threat to public health and safety. /r/n/r/n. There are 2 hepatitis A vaccines approved for use in the United States. /r/n/r/n. The influenza vaccine protects against seasonal flu. For most people, seasonal flu is nothing more than a nuisance, causing short-term illness. However, for some, flu can be severe and even life-threatening. Babies, older adults, and people with compromised immune systems are among those with a high risk of complications. /r/n/r/n. Because the virus mutates quickly, annual vaccination is needed to avoid infection. /r/n/r/n. While most flu vaccines are given by injection, there is one that is delivered by nasal spray, flu mist, and another that can be administered with a jet injector, Afluria, for people aged 18 to 64. 3 of the vaccines, Fluad, Flublok, and Fluzone High Dose, are specifically recommended for people ages 65 and older, who tend to have a less robust immune response to traditional flu vaccines. /r/n/r/n. Annual flu vaccination is recommended for everyone 6 months of age and older. There are 9 different flu vaccines approved for use in the United States. /r/n/r/n. Children 6 months to 8 years who have never been vaccinated should get 2 doses of the flu vaccine, with each dose separated by at least 4 weeks. Everyone else needs only a single dose each year. /r/n/r/n. Meningococcal vaccines protect against meningococcal disease, an illness caused by the bacteria Neisseria meningitidis. Infection with N. meningitidis can lead to meningitis, bacteremia, and septicemia. /r/n/r/n. Some meningococcal vaccines, called meningococcal conjugate vaccines, protect against common forms of the bacteria, namely serogroups A, C, W, and Y. Others protect against serogroup B bacteria, the most frequent cause of meningococcal disease in adolescents and young adults in the United States. One vaccine includes components of both types of vaccines and protects against serogroups A, B, C, W, and Y. /r/n/r/n. These are the meningococcal vaccines currently licensed for use. /r/n/r/n. Human papillomavirus, HPV, is a group of related viruses, some of which cause genital warts and others of which can lead to cervical cancer, anal cancer, and other types of cancer. /r/n/r/n. The CDC currently recommends vaccination in adolescents between 11 and 12 years of age. Vaccination can be started as early as age 9. The vaccine is also recommended for people through age 26 years who have not been adequately vaccinated. Adults 27 to 45 may also be vaccinated based on a shared decision with their doctor. /r/n/r/n There is one HPV vaccine, called Gardasil 9, approved for use in the United States. /r/n/r/n The herpes zoster vaccine protects against shingles, a painful condition caused by the reactivation of the chickenpox virus later in life. In addition to causing painful, blistering lesions, shingles can lead to severe complications, including chronic postherpetic pain and even vision loss if the eye is involved. /r/n/r/n The HZV vaccine is given to adults 50 and older and immunocompromised adults 19 years and older. There is only one shingles vaccine available in the United States, called Shingrix. /r/n/r/n An earlier shingles vaccine, called Zostavax, was discontinued in November 2020. Even if you've received Zostavax in the past, the CDC still recommends that you get vaccinated with Shingrix. /r/n/r/n Coronavirus disease 2019 COVID-19 is a respiratory infection that became a pandemic in 2020. Symptoms are variable, ranging from mild flu-like symptoms and the loss of taste or smell to pneumonia, respiratory failure, shock, and death. /r/n/r/n Since the pandemic began, the Food and Drug Administration, FDA, granted emergency use authorization, or FDA approval to 4 COVID-19 vaccines. 3 of those options are still available. /r/n/r/n The CDC regularly recommends that all adults and children receive updated vaccines as new COVID variants develop. /r/n/r/n Updated vaccines that protect against current variants are now available. They are recommended for all people aged 6 months and up. /r/n/r/n Rabies is a serious viral illness transmitted by the saliva of infected animals. It can take weeks, months, or years for symptoms to appear, but once they do, rabies almost always leads to death. Rabies is rare in the United States and other parts of the developed world. The greatest number of cases are seen in India, China, and the Democratic Republic of the Congo. /r/n/r/n Even so, people in the United States who are at risk of exposure, including veterinarians, animal handlers, spelunkers, or rabies laboratory workers, may be offered the vaccine as a precaution. The same applies to travelers to parts of the world where rabies is widespread. /r/n/r/n Similarly, people who are bitten by animals, including domestic ones, are routinely given rabies shots as a precaution. Bats are the most common source of rabies in the United States, although raccoons, foxes, and skunks can also be carriers. /r/n/r/n There are 2 rabies vaccines available for use in the United States. /r/n/r/n 3 doses of the vaccine are used for pre-exposure vaccination, to prevent infection, while 4 doses are used for post-exposure prophylaxis, to avert infection after possible exposure, for people who have not been previously vaccinated, and only 2 doses are needed for those who have been previously vaccinated. /r/n/r/n Cholera is a gastrointestinal illness caused by the Vibrio cholera bacteria. Cholera causes watery diarrhea that can run the gamut from mild to life-threatening. The infection is transmitted through contaminated water in areas with poor sanitation. /r/n/r/n Cholera is rare in the United States and not a disease for which American residents are routinely vaccinated. The vaccine is used for people traveling to, or living in, tropical areas where the disease is widespread. Some countries will require proof of vaccination before you are allowed to enter. /r/n/r/n There is one FDA-approved cholera vaccine, called Vaxchora, that is given as a single dose at least 10 days before travel to an endemic region. /r/n/r/n Japanese encephalitis virus, JEV, is a mosquito-borne disease that occurs mainly in rural and agricultural parts of Asia and the West Pacific. Most JEV infections are mild but, in some people, the infection can turn serious and cause brain inflammation, seizures, and even death. /r/n/r/n There is one JEV vaccine licensed for use in the United States, called IXIARO, that is given in 2 doses and completed at least 1 week before travel to an endemic region. /r/n/r/n Yellow fever is a mosquito-borne viral disease common in sub-Saharan Africa and South America. An infection can cause fever, muscle aches, nausea, vomiting, and the characteristic yellowing of the skin and eyes, jaundice. Severe cases can lead to gastrointestinal bleeding, acute kidney failure, encephalopathy, and cerebral edema. /r/n/r/n Yellow fever vaccination is indicated for people 9 months and older traveling to endemic regions. There is one yellow fever vaccine, called IVVAX, given as a single dose at least 10 days before travel. /r/n/r/n Typhoid fever is a bacterial infection called Salmonella typhi. Symptoms include high fever, weakness, fatigue, headache, loss of appetite, stomach pain, and occasionally a rash. The bacteria is transmitted via contaminated food and water. /r/n/r/n Typhoid is prevalent in parts of the world with poor sanitation, including parts of Asia, Africa, the Caribbean, Central America, South America, and the Middle East. /r/n/r/n There are 2 typhoid vaccines available for use in the United States, both of which are given before travel to an endemic region. /r/n/r/n Timfimvi should be given at least 2 weeks before departure to an endemic region, while the Vivotif vaccine series should be completed at least a week before travel. /r/n/r/n Before traveling abroad, check the CDC Traveler Advisory website for vaccine recommendations for your destination. /r/n/r/n Get our printable guide for your next doctor's appointment to help you ask the right questions. /r/n/r/n Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n/r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.